Thank you, Caroline. So I'm excited to be sharing about immune function with you all. And yeah, let's just get started. Like I mentioned, I've tried to pack a lot into this talk, so there's lots of good nuggets of information. If you're not familiar with naturopathic medicine, I'm a naturopathic doctor or naturopathic physician. And naturopathic medicine is really all about getting at the underlying cause of what's happening with your health and addressing that. So it's very, very individualized, and we really work to support the whole body, the whole person as a whole, seeing the patterns, the connections between things, and how we can most efficiently and elegantly help someone to be healthier. And we try to use the simplest, least invasive means possible. We use natural things when it's appropriate, and we know when to refer when someone needs more care. And it's very integrative. Most of my patients see other doctors as well, and I encourage people to see other doctors, especially when it's needed. So all of that said, that's naturopathic medicine in a nutshell. If you are interested in learning more about naturopathic medicine, I have some information on my website, which is at the very end of the presentation. And there's a lot of information available online as well. So that's naturopathic medicine. And now, before we get started, as kind of an overall note, this is really great information, but it's for informational purposes only. It's not medical advice. Always check with your own healthcare practitioner before making any changes to your health plan or starting any new supplements. So today, or tonight rather, we're going to talk about immune function. So we'll go through some basics of the immune system, and then we'll talk about some supportive strategies that include things like botanicals, so plant medicine, and also micronutrients, things like vitamins, minerals, antioxidants, hydrotherapy, nutrition, and lifestyle. And then we'll wrap up with a little bit about whole person health. And we'll go from there. Okay, so just an overview of immune function. So we all know your immune system is your body's like protection against pathogens, right? So it's what protects your body and what really keeps you well. And we want to keep your immune system functioning in an optimal way so that it can keep you healthy and protect you, but also so that it doesn't get confused and potentially lead to other concerns that we don't want. So immune cells are found throughout your body in lots of places because they're protecting you all over. So they're found in things like your lymph fluid, your lymph nodes, your spleen. Your spleen is a big organ in your abdomen that's really involved with immune function, in your epithelial tissue, which is like your skin, for example, in your connective tissues, and in secretions like mucus or phlegm. So immune cells are really everywhere in your body. They're patrolling, they're keeping an eye on things. And your immune function, your immune system function is really comprised of three overall things. It's physical barriers as the first step, and then innate immune response, and then adaptive immune response. So the first thing that any kind of bug you encounter is going to meet is the physical barrier, for example, like your skin. And then we're going to get to the innate immune response, and then the adaptive immune response comes later. So let's just talk about each of these briefly. So physical barriers, this is things again like your skin and also your mucous membranes. So for example, in your mouth, like the inside of your cheeks, that's a mucous membrane all the way through your gut. And then secretions, so things like mucus, phlegm, again, if you have like a runny nose, for example, all of that's kind of like an immune protective mechanism. So that's the physical barriers. That's like the first line kind of to catch invaders, to catch pathogens before they can get further into your body. And then next, and I have this little box on the side because I like to have kind of the overall view of things too. So next we have this innate immune response. This is like your body's first responders, and they act pretty quickly to respond when there's a pathogen. So your immune system's starting to get more involved here. It's not a specific response, that takes a little bit longer. And there's no immune memory involved with the innate immune response. It's just kind of like the first responders coming out because there's something there that they need to protect you against. And then we get into the adaptive immune response. And this is where there's really a lot of research, and this is where a lot of immune studies are really focused. There's so much here in the adaptive immune response. So this is your body's more specific response. And this is where antibodies are produced to help your body fight off a pathogen or an invader. Immune memory comes into play here too, and immune memory really helps your body, your immune system in the future if you encounter whatever that pathogen is again. So within that adaptive immune response, we have the antibodies that your body produces. So you have antibodies and antigens, and the words are kind of similar, but they're different. So the antigens are actually like the pathogens, the invaders that are triggering the immune response. So you can kind of think of antigen, pathogen. And then the antibody is what your body is producing. It's your immune signal to attack an antigen. So the antibodies, again, they're produced by your body. They can bind to antigens, and they can also tell other immune cells to attack antigens. So just one more time to be clear, because this is just important. You know, it's nice information to have overall, but we'll talk about this throughout the notes here too. So an antigen is a pathogen or an invader, and an antibody is part of your immune response. It's produced by your body. And in the picture over here, the antibodies are the little blue guys that look like Ys. And the antigen is this, it's like the pathogen, it's this big red guy here. So the antibodies are coming out, and some of them are going to stick to that antibody, stick to that red guy. And now within your adaptive immune response, we have two main aspects. So we have the humoral response, and then we have the cellular response. The humoral response is faster, and the cellular response has some more steps that are involved. And it's mostly mediated by your cells, whereas the humoral response is mediated by your B cells. Of course, you don't have to remember all of this. We're getting a little bit more detailed now, but just know there's a lot of different steps involved here in how your adaptive immune system is responding. So your immune response, of course, involves lots of different white blood cells, and there's many types of white blood cells. Here are some of the most common, and it's kind of fun to see the pictures. So the neutrophils over here, and then the lymphocytes, eosinophils, and mast cells, and there's more. The neutrophils tend to be the ones that kind of come out for an acute infection. The lymphocytes in general can be a little bit more chronic. Eosinophils tend to respond to things like parasites, or sometimes if people have different types of allergies or asthma, those can be elevated too. And then there's a lot more to talk about with immune cells and white blood cells, but just a quick overview. Now lymphocytes. So lymphocytes, again, they're a type of white blood cell, and we're still in this big area of the adaptive immune response. So lymphocytes, we have B lymphocytes. They respond pretty quickly to the antigen, to the invader. And then we have T lymphocytes, which will respond to the antigen only if they're signaled by an immune complex. And then we have natural killer cells, which just attack the antigen, kind of like their name, they're natural killers. So these are some different types of lymphocytes. And then cytokines. So if you've heard the word cytokines before, cytokines are part of the immune response. They're part of both the innate and the adaptive immune response, and they help to regulate and stimulate immune activity. They're secreted by different immune cells, and they're also secreted by other types of cells. They don't have to be immune cells. Cytokines, in addition to working with the immune pathway, they work with other pathways, and they include things like interferons, interleukins, and growth factors. So cytokines are something that if they're increasing, that means that immune activity is increasing. They're part of that pathway for immune action. And then just a note about inflammation, because we hear this term a lot. So inflammation is a really important part of immune function. It's not all bad. It's only when it gets out of control or it's inappropriate that it becomes an issue. And that's what's become more common today. So it's talked about more. But at its core, inflammation is just part of the immune response. We need it to happen for us to be healthy. So inflammation can be a problem sometimes when it occurs in chronic diseases, and it can also happen in acute illnesses, and it can make things worse, and it can make things worse quickly often, but it is an important aspect of immune function. Okay, so there's a lot of different details and nuances to your immune system and to your body. The body really is amazing, and the immune system is just kind of a part of that amazingness. So it's important to make sure that your body as a whole is well to allow for your immune system to function properly. when the body's dealing with different things, different stressors, illnesses, it can impair your immune function. So for example, just a few examples here, autoimmune conditions, cancerous conditions and infections, all sorts of different things can come when the body's not able to regulate itself at its best. So really keeping your body in kind of tip-top shape can help to optimize your immune function. And if your body is really working at its optimal, your immune system should be as well, kind of like a well-oiled machine in a sense. But just overall, with all that we're going to talk about, just keep in mind that your body really is amazing and it really wants to heal itself with the immune system's function. So the healthier state that you're in, the more capable your immune system is going to be. Keep your whole self well to optimize your immune function. Okay, so let's talk about some potential supports and strategies for immune system health. As a reminder, this is all informational purposes and not medical advice. I have to say that. Okay, so again, we're going to talk about botanical medicine, micronutrients, hydrotherapy, nutrition, and lifestyle factors. So let's start with botanicals, plant medicine. So echinacea is this beautiful flower we see over here, and this is pretty common in this part of the world. So you've most likely seen echinacea all over the place. Echinacea is actually immune stimulating. It can improve how your antibodies bind to antigens. So remember how we talked about the antibodies your body produces, and then the antigens are like the pathogen. It can improve that binding so that it's more protective for you. Echinacea can also increase white blood cells, including neutrophils, which we talked about there, the natural killer cells, another part of that adaptive response, macrophages, and more. So it really has a lot of immune stimulating properties. You do want to be cautious though with echinacea, and this isn't talked about that often, but naturopathically, we want to look at the whole picture, and we want to be cautious if someone has a lot of autoimmunity going on. And if you have ragweed allergies, echinacea can be a trigger for that. So there's a lot of different plants to choose from when you're choosing immune supportive things and things for other purposes. So just being aware that echinacea is one that if you have some autoimmune stuff going on, it may not be the best choice for you. A review that was published in the Lancet Infectious Diseases stated echinacea decreased the odds of developing the common cold by 58% and the duration of a cold by 1.4 days. And they went on to say, published evidence supports echinacea's benefit in decreasing the incidence and duration of the common cold. So that's pretty self-explanatory, but just showing that echinacea decreased the chance of developing a cold, so it was preventive. And then it also decreased how long that cold lasted. And the Lancet is a well-respected publication. It's not an alternative type of publication. A review that was published in Holistic Nursing Practices stated, the research study in this review represents the largest clinical trial to date, this was in 2016, that evaluated the safety and efficacy of echinacea for prophylactic treatment of the common cold, in addition to investigating its risk-benefit in a long-term treatment period, which for them was 4 months. So they used echinacea for 4 months. And then they say echinacea's long-term prevention was associated with a reduction in the total number of cold episodes, a reduction in the number of days with colds, and a reduction in cold episodes requiring additional medication. So some really nice research here as well. Okay, and then we have reishi. So reishi is actually, it's a mushroom, so it's a fungus, but we're talking about it here with the botanicals. And the Latin name for reishi is Ganoderma lucidum. So with a lot of plant medicine, you'll see the Latin name for it next to the common name. So reishi has a lot of immune stimulating properties. It's also got some great antioxidant and antiviral properties itself, so it can kind of go after things on its own. It also has a nice tonifying effect for the body, and it can help support your adrenal health. So plants don't just do one thing, and fungi as well. They don't just do one thing. This has impacts on other parts of the body. It can also support mental clarity. It can have a really nice impact there for some people. It's available in lots of different forms. And the NIH provides a lot of information online. One of their books stated there is considerable evidence to support the immunostimulating activities of Ganoderma lucidum via induction of cytokines. Remember, we talked about those. Cytokines are those part of that immune pathway, and enhancement of immunological effector cells. Different components from Ganoderma lucidum were proved to enhance the proliferation and maturation of T and B lymphocytes, splenic mononuclear cells, NK cells, and they go on. So we're seeing that reishi can help to increase white blood cell activity. These T and B lymphocytes, the splenic mononuclear cells, the NK cells, these are all some of those white blood cells that we talked about. So we're seeing that reishi can really have a nice immunostimulating impact. And then they go on to say various components of Ganoderma lucidum, in particular polysaccharides and triterpenoids, show antioxidant activity. Antioxidants from Ling-Z, another name for Ganoderma lucidum, were found to be absorbed quickly after ingestion, resulting in an increase in total plasma antioxidant activity. And that's kind of cool that they were actually able to measure the total plasma antioxidant activity and show that that was related to the reishi. Now, another botanical, and this is actually not a plant itself, but it's a constituent or a compound that's found in plants, resveratrol. So it's mostly known for being in red wine, right? So it's in like red grapes. So we all kind of know it for that. But resveratrol actually can be a really powerful antioxidant, and we can use it in supporting people to target different types of illnesses. It has some nice anti-inflammatory properties too. The concentrated form is really the most therapeutic, meaning that the supplemental form is what you need to use to get the therapeutic benefits, really. If you're drinking a lot of red wine, potentially that could have, some other effects, but you're not going to get anywhere near as much as you would get in a concentrated form, by drinking red wine. It's nowhere near as concentrated. So just to kind of point that out. Now, there's lots of research on all of these. So a review article on resveratrol summarized, resveratrol can play a beneficial role in the prevention and in the progression of chronic diseases related to inflammation, such as diabetes, obesity, cardiovascular disease, neurodegeneration, and cancers, among other conditions. So resveratrol has a wide range of activity. Moreover, resveratrol regulates immunity by interfering with immune cell regulation, pro-inflammatory cytokine synthesis, and gene expression. So some nice immune benefits here too. And then they go on, at the molecular level, it targets, and now we're getting into some different immune-related and cell-related things. It targets sirtuin, adenosine monophosphate kinase, nuclear factor kappa beta, inflammatory cytokines, antioxidant enzymes, along with cellular processes such as gluconeogenesis, lipid metabolism, mitochondrial biogenesis, angiogenesis, and apoptosis. So that was like a lot of stuff, but just know that resveratrol really has a lot of different actions, and it's really a wonderful constituent because it kind of targets so many different things. Resveratrol, they go on, resveratrol can suppress pro-inflammatory genes expression. So really cool, right? It can suppress the expression of pro-inflammatory genes. The antioxidant activity of resveratrol and the ability to inhibit enzymes involved in the production of eicosanoids contribute to its anti-inflammation properties. So it's really this nice antioxidant, nice anti-inflammatory, really a nice supplement. And then, of course, we have elderberry. So elderberry has become so common now because it's effective and it's well tolerated. So elderberry is, we have this picture of the berries over here. They're really, really deep, rich in color. And that speaks to how rich they are in bioflavonoids and antioxidants. They really, if you ever use them, they will stain your hands. They're just so rich in these compounds. They have some really great antiviral properties. And when you make elderberry, most typically it's in a syrup form. but you can take it in other forms also. It tends to be very gentle and soothing for the throat, and it's very popular with children because the syrup has just a really nice palatable taste for kids and for adults. But it is a really nice immune supportive supplement. So some research now, a study that was published in the Journal of Functional Foods stated elderberry possesses immunomodulatory properties through stimulation of cytokines. Remember, there's cytokines again, so we're seeing some immunomodulatory action, and they're stimulating cytokines, so they're stimulating immune activity. Elderberry exhibits multiple modes of therapeutic action against influenza infection. Our data further support both direct effects of elderberry extract by blocking viral glycoproteins, as well as indirect effects by increased expression of interleukin-6, interleukin-8, and tumor necrosis factor. So those three guys, those are cytokines that we talked about. So it can help to increase the cytokine activity again to target what the immune system's doing. And it can also block the viral glycoproteins, which is part of that antiviral effect. A double-blind randomized controlled trial conducted with people traveling by airplane found that travelers who used elderberry from 10 days before travel until 4 or 5 days after arriving overseas, on average experienced a 2-day shorter duration of their cold and also noticed a reduction in cold symptoms. The data suggests that a significant reduction of cold duration and severity in air travelers was found. So this was a really interesting study, and they were able to do this double-blind RCT, which is often challenging with some of the plants that we use and the way that we use them. But the researchers in this study were able to do this by taking a big group of people who all were going to be having very similar travel experiences overseas. And they had one group that was the control and one group that was with the elderberry. And then they basically had them kind of record how they were doing. And they found this from all of their, the recordings and the people who got sick. So obviously not everyone got sick when they were traveling. So the people who did, they pulled out those journals and recordings from them, and they were able to analyze and come up to find that that the elderberry reduced both the duration and the severity of the colds, which is really quite interesting. Okay, so next we have fire cider. So fire cider, if you haven't heard of it, it's this really kind of spicy, tangy liquid. It's not like apple cider. You're not going to drink a glass of it. You would take like a little spoonful of it. It's a combination of plants that are extracted in vinegar. And this usually includes horseradish. That's kind of like the most important one in a sense. It's kind of the base. And then ginger, garlic, cayenne, or other hot peppers, apple cider vinegar, and you can put in other plants. A lot of people, when they're making this, will put in things like rosemary or even adaptogenic types of plants, anything that you want to kind of customize it. And you let it sit. And then after at least a month, you can take it, you can strain it, and you get the really good potent liquid from it. And that liquid is the fire cider, and it can be bitter and stimulating and really warming. It can also support your digestion, which you do want to be cautious with using this. If you have anything, any kind of gut conditions, you should check with your healthcare provider before using this, especially with things like heartburn or GERD, acid reflux, ulcerations anywhere in your gut, and other GI conditions. But this can be stimulating for the digestive system. So fire cider, that kind of core ingredient is the horseradish. The Latin for horseradish is Armoraceae rusticana. And so this study that was done, they looked at horseradish and they found that Armoraceae rusticana reduced reactive oxygen species release. Reactive oxygen species are inflammatory. So it reduced those, and it increased heme oxygenase 1 expression, thus contributing to the cytoprotective cellular effect during inflammation. So really helping to reduce inflammation and protect cells. And then we have garlic, and garlic was an ingredient in that fire cider too. I should mention just with the fire cider, you can find this locally. It's available widely, as is the elderberry. They're really widely available. Or you can make your own, which is great. And then garlic here. So garlic, Allium, sativum. Garlic is really well known for having some great antiviral properties and antimicrobial properties. It also has a lot of other health benefits, including for the cardiovascular system, and it really can help to kind of do a lot of cleanup work in the body. You can use garlic in a lot of different forms. It can be in a concentrated form like a supplement or in food form. And if you're using it in a food form, the best way to do it is to add it at the very end of cooking, to add fresh garlic at the very end of cooking. So for just like the last 30 seconds or so to really get a benefit. Using it for longer than that, you get some really nice garlic taste, but some of the garlic goodness, the health benefits, will be cooked off in a sense. So you could always add part of it and then add the rest of it later at the very end of cooking, because as it heats, it changes the properties of the garlic. And then you can add whole garlic cloves to things like stews or soups and even smoothies. You will taste it usually in a smoothie, but it'll give you a nice little kick in the morning potentially if you have a smoothie. And then if you are sensitive to garlic, potentially you could try removing the very inner bulb in each clove. So when you cut a clove of garlic in half, you'll often see like a little inside middle part, and it'll often look green. Sometimes it looks like it's starting to grow a little bit. If you take that out, that can be the most allergenic part of the garlic. If you take that out, you could be able to tolerate the garlic much better. So for garlic, a review that was published in the journal Trends, Food, Science, and Technology found preclinical data demonstrated that garlic and its OSCs, which is organosulfur compounds, have potential antiviral activity against different human, animal, and plant pathogenic viruses through blocking viral entry into host cells, inhibiting viral RNA polymerase, reverse transcriptase, DNA synthesis, and they go on. So a lot of antiviral activity. And then they go on to say, clinical studies further demonstrated a prophylactic effect of garlic in the prevention of widespread viral infections in humans through enhancing the immune response. So garlic is just a wonderful, wonderful food. And then we have quercetin, and this is a really great compound that's also found in plants. Similar to resveratrol, quercetin is not a plant, but it's a compound found in plants. So quercetin is especially found in the onion family or the Allium family of veggies. Red onions are a really great source of quercetin, but you can also find it in foods like apples are a nice source. It's in other foods other than just the onions. Quercetin is really anti-inflammatory. It helps to prevent the release of histamine, and histamine is kind of that trigger for the allergic response. So this can be really nice. Quercetin can be really nice for reducing seasonal allergies and sensitivities. It's a pretty common player in a lot of anti-inflammatory supplements because it's so helpful in decreasing that kind of allergy response to things. Okay, a study on quercetin reported that quercetin displays a broad range of antiviral properties which can interfere at multiple steps of pathogen virulence, virus entry, virus replication, protein assembly. So quercetin can also help to kind of mitigate some of those viral actions. Okay, so that was all of our botanicals for right now. Now we're going to talk about micronutrients. So micronutrients. So the first one here is probably one of, if not the most well-known micronutrient, vitamin C. So vitamin C is so great. It's well known as a really potent antioxidant. It's well studied. It really helps to clean up inflammatory damage in the body. It helps to kind of quench those things like free radicals and clean up oxidative stress. It's good to take vitamin C with other antioxidants or in a food form rather than just by itself. You do want to be careful, as many probably already know, you do want to be careful. If you have too much, it can cause looser bowel movements. But if you get a buffered form of vitamin C, that can really reduce the chance of having looser bowel movements. And a buffered form is kind of like having it with some other kind of food stuff in a sense, or plant stuff, depending on what kind of buffer it is. So vitamin C, take it with other stuff, with other antioxidants, and with or in food form. Okay, so a recent article in the journal Frontiers in Immunology stated there is evidence that vitamin C and quercetin, which we just talked about, vitamin C and quercetin co-administration exerts a synergistic antiviral action due to overlapping antiviral and immunomodulatory properties and the capacity of ascorbate, which is vitamin C, to recycle quercetin, increasing its efficacy. So we're seeing that vitamin C with that compound quercetin have a really nice anti-inflammatory and antiviral synergy. The synergy there means that the sum of both of them is greater, or both of them together are greater than either one individually, and they actually really benefit each other. So it's not just that they add 1 + 1 = 2, you get a lot more benefit because they have a synergy. And like the vitamin C here, they saw that it recycled quercetin, so you get even more kind of bang out of your quercetin buck, which is cool. All right, so then vitamin D. So vitamin D is another one that's talked about a lot. It's really important for your proper immune function and for a whole lot of other systems in the body. This is a really important vitamin. I like to think of it as a sunshine vitamin. But it's actually a hormone. It's not a vitamin at all. It's a hormone. So it is important for your hormonal pathways as well as other things in your body. Just for example, most people don't get enough vitamin D from sun exposure alone. The best places to get more vitamin D if you need it are in supplements and in fortified foods. And vitamin D is a test. It's a basic lab test that healthcare providers can check if they feel it's appropriate. And it is important if you do take vitamin D to have your level monitored because it's rare, but in some people, vitamin D can go really high and we don't want that to happen. That's not good. That's rare, but you should be monitored with vitamin D to make sure that that doesn't happen. Okay, and then a review in the journal Nutrients on vitamin D found that through several mechanisms, vitamin D can reduce the risk of infections. Those mechanisms include inducing cathelicidins and defensins that can lower viral replication rates, and reducing concentrations of pro-inflammatory cytokines that produce the inflammation that injures the lining of the lungs, leading to pneumonia, as well as increasing concentrations of anti-inflammatory cytokines. So vitamin D can do a whole lot with helping the immune system to function well. And then zinc. So zinc is a really important mineral for immune function as well as other pathways in the body. And you may be sensing a theme here. A lot of these micronutrients, they support other pathways in the body as well as immune function. So it's not just kind of a one thing does this one thing. There's a lot of impact from one mineral. It doesn't just kind of address one thing by itself. It addresses a lot of things. Which is really cool for, figuring out what's going to best support someone. So zinc is really important for immune function and for a lot else in the body. It does help with tissue healing. It's found in foods, in oysters, the highest in oysters really, and then also in beef, lobster, chicken, pumpkin seeds, and more foods, but oysters are by far the highest for zinc. A review article for zinc provided a general summary that after the discovery of zinc deficiency in the 1960s, it soon became clear that zinc is essential for the function of the immune system. Zinc ions are involved in regulating intracellular signaling pathways in innate and adaptive immune cells, which we talked about. So that's really 2 of the 3 big immune pieces. And then also anti-inflammatory and antioxidant properties of zinc have long been documented. So zinc is a really important mineral, basically. If you do take supplemental zinc, it's something that you should take with food, both to optimize absorption and to really minimize any chances that you might feel a little bit nauseous after taking it. And then NAC, so N-acetylcysteine. So this is a wonderful micronutrient if you're not familiar with it. So cysteine is an amino acid. An amino acid is a protein, basically. So this is actually a protein, but we don't use it like a protein. We're not using it to give someone, protein. We're using it for specific therapeutic purposes. And NAC has a lot of different actions. It's a really nice mucolytic, meaning it breaks up excess mucus. And excess mucus, that's tied to the immune function as well, oftentimes. So if somebody's immune system is really a little bit overzealous and producing lots of phlegm and stuff like that, it might get to be a little too much potentially. It's a protective mechanism, but when that's going on chronically, that's not necessarily something that we want to happen. So having a mucolytic can be a really nice option, helping to break up that extra mucus. It can also be supportive for respiratory health. So NAC can be really nice for kind of upper respiratory and lung health. It can be supportive for detoxification pathways in the body, and it's supportive there because it actually can be the rate limiting step in how your body makes glutathione, which is one of its very important antioxidants that it makes. Glutathione is one of 3 antioxidants, main antioxidants that your body manufactures. And glutathione production is often limited when it doesn't have enough, your body doesn't have enough of the precursors for glutathione. NAC, N-acetylcysteine, is one of those precursors, and it's usually the rate limiting step in making that glutathione. So detoxification-wise, supporting your liver, NAC can be really, really nice there too. And then NAC has other properties that, we're not going to go into right now. So NAC, a review article in Antioxidants stated, NAC has been an established drug since the 1960s. It is on the World Health Organization's list of 40 essential medicines and is available as an inexpensive generic drug. It has been classically used in paracetamol overdose. Paracetamol is acetaminophen, it's a name for it in Europe, or Tylenol, and as a mucolytic, as well as to combat the toxicity of various substances that can cause generation of free radicals, such as carbon monoxide and X-ray contrasts. So this review is nice because they summarize well here. NAC is on the World Health Organization's list of 40 essential medicines. So that's pretty impressive for a micronutrient, right? That's pretty impressive. It's one of 40 essential medicines. It's inexpensive. It's kind of easy to get usually. And using it in paracetamol overdose, again, that's like Tylenol, because it does have that supportive property and action with regard to detoxification for the body. So it's widely used in other parts of the world more so than here. Okay, and then one last, this isn't really a micronutrient, but it kind of fits into this category the easiest. So one last strategy here is probiotics. Probiotics can be really immune supportive, but probiotics is a really general term. So probiotics are beneficial bacteria that we use to help the body to have a more balanced, robust microbiome, which is the microbiome is all the healthy bacteria that lives in the digestive tract that helps to keep things kind of optimal there. And it also plays a role in your immune function. I know this is a lot of different pieces of information, but probiotics is a very general term. So when we're thinking about probiotics, it's important to look at what's actually in a probiotic, meaning the different strains of bacteria, of beneficial bacteria, the species and the combination, and also how potent it is. And probiotics are measured in CFUs, which refer to how many bacteria are in the probiotic, and the bacteria are living probiotics. So it's important to, get a decent quality probiotic if you are using one, just because it's live bacteria. And if they're getting killed during transportation or storage or even manufacturing, you're not going to get the benefit of the bacteria. So it's important to get a nice probiotic. Okay, so probiotics in general support the microbiome, which is important in immune health, and it's also affected when someone's unwell. Your microbiome in your gut is really essential for so much that happens in your gut, but also in the rest of your body. It plays a role in your neurotransmitters for sure. It plays a role in digestion and also in bowel movements and all sorts of other gut health. So helping that microbiome in your gut to be healthy is really important. And we know that when someone is unwell, that their microbiome is going to need support. Okay, so a study published in the journal Synthetic and Systems Biotechnology stated the consumption of probiotics significantly reduced the incidence of upper respiratory infection and flu-like symptoms with an oral temperature higher than 38 degrees Celsius as compared to the placebo group. So they compared their probiotics were 30 million plus CFUs of lactobacillus species. That's the bacteria. And that's what they compared with the placebo. And they found this result, which is nice. And again, all probiotics are different. So that's not to say that every probiotic is going to have similar effects, but just an example. Okay, so now on to hydrotherapy. How are we doing on time? Carolyn, do you know?
It's 6:43 right now. So.
Okay. So we have a little bit more to go. All right. Thank you. So in hydrotherapy here, hydrotherapy is really the use of water therapeutically, just like it sounds like, hydrotherapy. So hydrotherapy, we have something called contrast hydrotherapy, and this has actually been used for hundreds of years, centuries really. It's a very traditional medicinal practice used throughout the world. Hydrotherapy is very simple. Contrast hydrotherapy is basically meant to stimulate more circulation in the body by using hot and cold applications of water. So hot water is going to pull blood to the area where it's placed on the body, and cold water is going to push the blood inward. So by alternating that hot and cold treatment on the body, it helps your blood to move in and out, because we're pulling water out with a hot water treatment, and then we're pushing the blood in with a cold water treatment. So that stimulation for your circulation can really help to move things a lot more. That can help with your immune function, but it can also help with tissue nourishment. It can help with a lot. This can be really nice when you're starting to feel a little bit unwell, or at the start of like a cold or something like that. And now just a little bit more detail on what this is exactly. So contrast hydrotherapy, you want to alternate hot and cold 1 or 2 times. And you can do this, traditionally this is done like in a therapeutic setting, meaning you go to a clinic and they do this there. You can potentially do this at home if you want to, but you basically alternate the hot and cold. So hot for 5 or 10 minutes, you want to get nice and hot before you use any cold. And then you would do cold for 30 to 60 seconds. So the way we do this sometimes is with towels or sheets. You can also potentially do this in something like a bath or a shower. But first you do want to make sure that you're hot, and you don't want to apply anything cold unless you're hot first. And then it's nice to end with cold, because that will help to be kind of extra stimulating as you end. If you have any kinds of neuropathy or other health conditions, you should check with your doctor before doing something like this. But this is a very old kind of traditional type of medicine that can be really supportive for people. And just actually, you know what, for time, I'm not going to mention that. I'm going to keep going. One other kind of simpler hydrotherapy technique is to wake up your thymus gland. Your thymus gland is in the picture here, you can see in the upper right. But your thymus gland is in your upper chest, and it's this little gland. It's part of your immune system. It does shrink with age. So when we're babies, the thymus gland is much larger than it is as adults. As adults, it really starts to shrink pretty quickly, and it can be almost kind of gone in a sense by the time you're a certain age. You can theoretically stimulate the thymus gland with a blast of cold water. Even if it's very small, it's still doing some immune work. So you can theoretically stimulate it with a blast of cold water, which can be as simple as at the end of a hot shower, let the cold water hit you in that upper chest area, right somewhere where it's going to hit that thymus area. Let it hit you there for as long as you can tolerate, up to 30 seconds. And that can give you a nice stimulation, and it might wake you up even. You want to make sure to do that when you're warm, not when you're cold. You want to be nice and warm, hot before you do anything with cold. Again, just because we want to avoid other issues. Okay, So that's hydrotherapy. And then nutrition. So nutrition is so important as a foundation for health. So I do want to just go through some kind of simple things related to nutrition that are really nice immune supportive strategies. What you eat every day, you know, it's what's going in your body. It's medicinal, and we can use it as medicine. And it can also be kind of toxic for the body. So, you know, just thinking about if we're supporting the immune system, is what you're eating, you know, feeding that, supporting the immune system, or is it taking away from? Is it a detractor? So in that context, and also just overall, nutrition is so essential for foundational health. So the first nutrition tip I have here is to eat berries. Berries are loaded with bioflavonoids and other antioxidants. All types of berries are really wonderful. Berries tend to have a lower glycemic load than most other fruits, which is really nice. It means they're not going to affect your blood sugar as much. So some examples: blueberries, raspberries, mulberries, blackberries, strawberries. Wild blueberries specifically, have been studied a little bit more and shown to have some really great antioxidant power. If you can choose organic, that is going to be better with berries. Berries absorb more pesticides. They have a very thin skin. So, you know, conventional berries, you will certainly get health benefits from them, lots of antioxidants, but organic, to minimize any pesticide exposure, would be really nice. And local, if you can, is always nice. My next nutrition tip here is to minimize sugar. This one can be hard for so many of us, but this one is really huge for overall health, but also for your immune system to be able to function properly. So simply put, sugar feeds inflammation. Very simple. So much research on this. It also takes resources away from your body's ability to respond, from your immune responsiveness when your body has to deal with a sugar, with that kind of chronic inflammatory load that sugar brings. And it also contributes to so many other health conditions that we know about. So much to talk about there, but really immune-wise, sugar is important to reduce. It doesn't mean you have to fully avoid it and deprive yourself, but really be mindful of how much sugar am I having in a given day. You know, I read something recently that estimated people have 150 pounds of sugar every year in America. Now that's a lot of sugar. That's like, you know, I don't know, half a pound a day-ish. That's a lot of sugar. So minimizing sugar, really important there. Look at all your processed packaged food labels, and you don't want to see much sugar in anything really. And choosing whole foods can be a way to get away from that as well. Okay, next is to eat colorful veggies. So we know vegetables are a great source of health, antioxidants, fiber. The more deeply pigmented the veggies are, the more concentrated they are in antioxidants. And you want to look for those deeper, richer, brighter colors, dark colors, and you want to eat a variety of colors to get a variety of different micronutrients, like vitamins, minerals, antioxidants. So if, for example, if you love like carrots and pumpkin and sweet potatoes, that's a lot of orange stuff. So add some variety in there. If you're eating kind of all the same color palette of veggies, add some variety so that you get a nice mix of different micronutrients. So just some examples here that are really nice: Swiss chard, beets, collards, carrots, broccoli, and there's so many, but veggies are really great. And just one note also, when you're getting like berries and veggies, frozen is also great. You're still going to get a lot of nice benefit from frozen veggies. You know, it doesn't have to be hard necessarily or really costly, but, you know, make it easy for yourself to succeed if you want to do some of these things. Make it easy to succeed. Grab some frozen berries, some frozen veggies, keep them kind of stocked up for yourself so that you can grab them easily if you need to. And the same goes for fruits. With eating the colorful, deeply pigmented, just pay attention to the portion size with fruits to avoid really upsetting your blood sugar levels. And if you can choose more veggies than fruits in a day, that's kind of a nice way to think about it. If you've had more veggies than fruits, that's going to benefit you blood sugar wise and more. Okay. And then staying hydrated. So just like Sue showed her water bottle earlier, this is so important. So aiming for about half of your body weight in ounces is a general rule of thumb for hydration. Water is best. Caffeinated drinks like coffee or sodas and some strong teas are actually dehydrating, meaning that you need to hydrate more after drinking them. And that may be counterintuitive for some people because, you know, thinking about it, you make coffee with water, so why wouldn't you get the benefit of water? But you actually don't. The coffee kind of pulls the water from your body a little bit, so you actually need to rehydrate when you have coffee. It doesn't mean you need to avoid it, but just be mindful, be moderate, and really pay attention to hydration. And then avoiding sweetened and flavored beverages. They have a lot of additives usually, and the sweetener, you know, again, we want to minimize sugar, which also means if you can keep juices to less than 4 or 6 ounces a day, that's really ideal. If you're having juice, you can add water to the juice to make it like a more full glass, but sugar is going to be, or I'm sorry, juice is going to be kind of liquid sugar that's readily absorbed by your gut. So it's going to go into your body much quicker. And then bone broth. So bone broth is wonderful, especially this time of year when it's like cold flu season and it's cold outside. There's many benefits with bone broth. It has a lot of nutrition in it. It's nice and warming. It's gentle. It's really easily absorbed. It tends to be really well tolerated. Bone broth is different than just straight up like chicken broth or beef broth. Bone broth is actually, it's made from bones that include the marrow. So you can make this at home or you can buy this, but it's the bones that still include the marrow. And the marrow has so much nutrient value in it that that's where, when the broth it kind of extracts that, you get a lot of benefit. You essentially simmer the bones with the marrow with any veggies that you like, and that's your bone broth. You can also buy this locally at a lot of grocery stores. If you can get higher quality, that's going to be best, like free range animals or grass fed, etc. And bone broth is really flexible too. You can use it as a snack, as part of a meal. It can be the base for a vegetable soup, so it doesn't have to seem like something out of the ordinary necessarily. And it's just really nice and supportive for healing for your whole body, but really nice for immune function, especially if you start to feel a little bit unwell. Okay, and then last nutrition tip here is to consider a 12-hour eating time frame. So you may already be doing this, but if you're not, consider it. So for example, eating all of your food between the hours of 8 a.m. and 8 p.m. so that then you have like a 12-hour food break in between there. That 12-hour food break or that overnight fast, that can really allow your body to spend less of its energy on the digestive process and spend more energy on other processes like immune function. And just on that note, you know, when you go to bed at night, your body does a lot of immune work and a lot of other work, but a lot of immune work. So if you're still digesting your food when you go to bed, it's taking energy and resources away from all the other stuff that needs to happen when you're sleeping, especially with your immune system doing what it needs to do. So try to have like a 2 or 3 hour buffer between your last food and bedtime, and then have that overnight fast can be really nice. Okay, so a few lifestyle things to support the immune function. Exercising regularly, really supporting your whole body health. Exercise strengthens and tones. It helps your metabolism. It can reduce stress. It helps move your energy. There's so much that exercise does to benefit overall health. It's really important, and this is a really great preventive strategy for just keeping your immune system functioning optimally. But if you are feeling unwell or sick, listen to your body and do reduce exercise so that you can rest and allow for healing. Healing happens often when we're resting. So if you feel unwell, don't force yourself to like go for a run or go to the gym or whatnot, unless you really feel up to it. Really try to listen to your body in a sense, what would be most beneficial for you. And then sleep. So again, getting enough rest. Sleep is when your body does a lot of cleanup work. Your immune system kind of comes in, your different immune cells, some of them come in and you can think of them as like sweeping up some debris and some, things that happened during the day, some of those battles between pathogens and immune cells. Your body's cleaning all that up. And your immune system is really pretty active at night. Most adults do require at least 7 hours of sleep. Many people kind of feel that they're fine with less than that, but many people today are actually pretty chronically stressed, and that can give them a false sense of being able to run on less sleep than that. It's really rarely the case, and research has shown this more and more, but it's rarely the case that people do well with less than 7 hours of sleep. Really, we need more because so much happens when we're resting. And of course, children and teenagers need even more than that. And a review article stated that sleep and the circadian rhythms, or the circadian system, exert a strong regulatory influence on immune function. So sleep is really important for immune function. Sleep on the night after experimental vaccinations against hepatitis A produced a strong and persistent increase in the number of antigen-specific Th cells and antibody titers. Together, these findings indicate a specific role of sleep in the formation of immunological memory. So meaning that after vaccination, you get a better effect when you really rest well, because sleep helps you, as I say, in the formation of immunological memory. That's those antibodies that your body produces, the immune memory. So they're ready to attack, kind of. And then stress. Stressing less. Easy to say, but challenging to do. But this could be like the #1 strategy for this whole immune talk. Stress can really wreak havoc on the body. Reducing stress would probably be the #1 thing for so many people to really help with immune function, reducing stress. Stress can really impair that healthy immune function, and it also affects so many other systems in the body that are going to kind of pull resources away if we're dealing with things immune-wise. So just being aware of your stress level and being aware of it, and then seeking support, doing things to take care of yourself when needed. Therapy and counseling can be a wonderful support, especially during this pandemic time for people, really seeking support if you need it. And then of course, mindfulness practices. So this is things like deep breathing, yoga, meditation, journaling, anything that brings you a greater sense of calm. And sometimes this can also be things like going out for a walk or going for a drive, or even like, you know, to a responsible degree, like doing some online browsing, or just things to kind of calm you that are not going to require a lot of input or bring up a lot of anxiety or adrenaline or feelings of stress. So things that are meant to be calming and mindful. Stress is huge. So really being aware and working on stress. And then just a note about whole person health. So staying well through all aspects of your health is important for your immune system to function well. I know I've mentioned this kind of throughout here, but it is important to keep in mind. Making those healthy choices in different areas of your life is going to help your immune system to function optimally. As the saying goes, an ounce of prevention equals a pound of cure. And that's very true. The more we can do to take care of ourselves now, the less there is to do later, because we can avoid so much. So with whole person health, it is important to see whoever your healthcare provider is that you trust for regular check-ins. A naturopathic doctor can be a great resource and typically works well with your other providers, but whoever you see, it's important to do those regular check-ins, especially as we get older, because you want to make sure that things are working well and that your lab work looks good and that everything is kind of functioning optimally, and that if it's not, we address it sooner rather than later. So do seek support and do follow your provider's recommendations for all of that. It's a kind of a side note, but an important side note, that just taking care of yourself is really essential. So all of that, a recap real quick. We talked about an overview of immune function, and then we talked about different supportive strategies like botanical medicine, micronutrients, those vitamins, minerals, amino acids, and then hydrotherapy, nutrition and lifestyle, and whole person health. And just remember, the healthier state that you're in overall, the more you do that self-care for yourself with all these different things, whatever is resonating with you, the more capable your immune system will be and your whole body. So keep your whole self well to really optimize your immune function. And as a reminder, this is all for informational purposes only. It's not medical advice. Always check with your own healthcare provider. And now, if we have time left, I'd be happy to answer any questions. And if anyone is interested, I have a lot more free resources on my website, so feel free to check that out. And thank you for listening. I know that was a lot of information, but this was fun to share. Okay.
Thank you. Does anybody have any questions?
I have a question.
Yes.
You mentioned that NAC, I don't know if that's a pill or what that is, but you mentioned it in terms of respiratory health. And I was wondering what your thoughts are regarding asthma and that. And of course, I would check with my, my doctor and, that kind of thing. I was just curious because that wasn't in your list of like conditions, but you did mention in general, like lung and respiratory things. So has that ever been used in relationship to asthma?
Yeah, yes. So that's a great question. So to answer the first part, so usually NAC is in a capsule form, but capsules, you can kind of wiggle them apart and you can get the powder. So you can potentially also get it in a powder form, but it's typically in a capsule form that you would swallow. And then with asthma, so NAC wouldn't be the first thing that I would really think of with asthma, but it's not a contraindication for it, and it could potentially be supportive in the context of your overall health, but it does have some nice support for the upper respiratory system. And what else did I want to say? Oh, the glutathione, the antioxidant that I mentioned, NAC is it's the rate limiting step typically in glutathione synthesis, that glutathione antioxidant. Glutathione can actually, it's sometimes, and I'm not recommending this, but it's sometimes nebulized, and that can actually be really nice for respiratory health. So that would be a discussion to have with your provider, but that's actually sometimes used and can be really nice, depending on what the situation is. But NAC, I would say not really directly for asthma, not as like an asthma treatment, but it could potentially be a nice support.
Yeah, support. Yeah, not as an only thing. Okay, and that obviously, we would check with the doctor and stuff. So just something I'd never heard of before. So I was like, oh.
Yeah.
Okay, thank you so much.
Yeah. You're welcome. Yeah, NAC is great. Yeah.
I just had a quick one specifically about the reishi, the mushroom. Would you recommend, is there benefits to the different forms? Is it better as a tea, a powder, or it doesn't really matter?
Yeah. So the different forms are gonna have kind of different potencies. So like a reishi tea is going to potentially give you some nice support, but not in as strong a way as like a powder that's concentrated, or as like a capsule, a supplement like that. But some of the reishi teas can be pretty strong. With reishi, I've actually found that with some of these, every plant is different, every person's different, but with reishi, everyone tends to respond a little bit differently and to the different forms. So with a tea, or even like a broth made of reishi, there's some nice mushroom broths that you can make. But even with something like that, you can really feel like a mental impact sometimes. And, it's really different for each person. Part of that is because reishi is also working on some other systems in the body. So it's not just, immune function, but it's supporting some of that adrenal health, and it can be powerful for people. So I would say, if you're just kind of thinking about it, potentially start with a tea because it's a weaker form. I shouldn't use the word weaker. It still can give you some nice benefits. And reishi, I wouldn't think of as being weak anyway, but it's a nice support with a lot of other nice properties. Yeah. So I would start with a tea potentially.
Okay. Thank you. Does anybody else have any questions? Doesn't look like it. So I really want to thank you, Dr. Cannon, for taking the time to give us so much great information. I know you take time out of your day to do this, so we appreciate that. And I hope that everybody can come to the next one, which is March 16th at 6 p.m. and that is Healthy Aging. So thank you so much, Dr. Cannon.
You're so welcome.
Thank you, everybody, for coming.